Welcome to my channel, Brainies. Today we are going to discuss about the topic Brown-Sequard syndrome. What is Brown-Sequard syndrome? It is also known as lateral cord syndrome. Actually, it occurs due to injury on one side of the spinal cord and can happen at any level. This syndrome usually results from a partial injury. The function in some of the parts of the spinal cord may be preserved. So this is a picture depicting the Brown-Sequard syndrome. Let us just see the etiology of Brown-Sequard syndrome. It usually happens due to any spinal damage which is caused by traumatic injury like gunshot injuries, a stab, vehicular accidents, road traffic accidents, or even the blunt force trauma. The non-traumatic causes includes the genetic spinal malformations, infections like meningitis, myelitis, herpes, and tuberculosis, radiation exposure, multiple sclerosis, epidural hematomas in which the blood collects inside the skull actually, spinal ischemia, spinal disorders like CS, cervical spondylosis, arachnoid cyst, intravenous drug use, spinal cord tumors, herniated disc, and decompression sickness. So let us just see the signs and symptoms of this BS, which is Brown-Sequard syndrome. There can be ipsilateral loss of deep sensation. Deep sensation includes the sensation of where your body is positioned in relation to space and the sense of vibration. When symptoms are ipsilateral, that is on one side of the body, it means that they occur on the same side of the body as a spinal cord injury. For example, if the patient sustained damage to the right side of the spinal cord, then he may experience deep sensation deficits in the same right side of the body. The next sign is the ipsilateral loss of motor control. Many individuals, patients with Brown-Sequard syndrome, exhibit loss of motor control as similar to the previous one on the same side of the body as that of the spinal cord injury. As a result of this one-sided weakness or paralysis, patient may experience difficulties in walking, balance, and to perform the everyday activities. Additionally, functions like bowel and bladder control may also be affected. Then the next signs and symptom is the contralateral loss of pain and temperature. Previously, we could see there is loss of deep sensation and loss of motor control on the same side as that of the spinal cord injury, that is on the ipsilateral side, whereas there is loss of pain and temperature on the contralateral side, that is on the opposite side of the spinal cord injury. So individuals usually experience pain and temperature abnormalities on the opposite side of the body, that is just opposite to the spinal cord injury. For example, injury to the right side of the spinal cord may affect the sense of pain and temperature on the left side of the body. In addition to these characteristic symptoms of Brown-Sequard syndrome, patient also may be at risk to the secondary effects of incomplete spinal cord injuries such as spasticity, ulcers, pressure ulcers, and muscular atrophy. Fortunately, some patients are able to overcome these complications and they are able to improve their mobility. So let us just see the treatment of Brown-Sequard syndrome briefly. The treatment focuses on promoting neuroplasticity to restore communication between the brain, muscles, spinal cord, and the peripheral nerves. Participation in the rehabilitation can help to identify the specific weaknesses in the particular area and target to promote the functional recovery. So the various interventions are, it includes occupational therapy, orthotics, botox injections, speech therapy, physiotherapy, and home exercises. Let us just see one by one. So the first one is the occupational therapy, which helps the patients with Brown-Sequard syndrome to maximize their functional independence. That is, it involves practicing the activities of daily living, that is, their own functions like dressing, performing transfers, or even preparing a meal. While many patients with Brown-Sequard syndrome have the potential to restore the motor functions, however, it will take some time and also effort. Therefore, the occupational therapist may teach the compensatory strategies such as using adaptive tools to improve their mobility. It also involves preparing the individuals to return back to school or even to work. So the next is the orthotics. Physiotherapists may recommend, even physicians, doctors and physiotherapists may recommend wearing the orthotics like braces and splints on the affected side to provide musculoskeletal support. Orthotics helps to hold the affected limb in place to minimize the risk of injury, prevent the further tightening of the spastic muscles and thereby promote the better form. So Botox injections. So patients with this particular syndrome, Brown-Sequard syndrome, experience involuntary muscle contractions, which is known as spasticity in the ipsilateral side, that is on the affected side. This can restrict the range of motion and may make it difficult for the individuals to participate in the daily activities. So to temporarily reduce the high muscle tone, which is the spasm, nerve blockers like Botox may be recommended. Unlike the oral muscular relaxants, this Botox is directly injected into the spastic muscle, so which blocks the signals that causes the muscle to contract, allowing the individuals to practice therapeutic exercises without the impact of spasticity. That is the role of the Botox. So next is the speech therapy. Many patients of Brown-Sequard syndrome are caused by damage to either the cervical or the thoracic regions of the spinal cord. These injuries may impair the control over the respiratory muscles such as diaphragm, which is the chief inspiratory muscle, and the intercostal muscles. As a result of this, the patient may experience difficulties in breathing and may develop the increased risk of developing respiratory complications. So it is a role of the speech language pathologist to evaluate the severity of the breathing difficulty and suggest exercises to improve the control over the respiratory muscles accordingly. The next is the role of the physiotherapist. So physiotherapy can help the individuals with Brown-Sequard syndrome to practice exercises, thereby to improve the motor control on the affected side. Continuously practicing exercises on the affected side will definitely improve the strength and the range of motion. Additionally, it will also stimulate the spinal cord and promote neuroplasticity. To help the individuals, the patients with Brown-Sequard syndrome recover their mobility, physiotherapists play an important role. They recommend a technique known as constraint-induced movement therapy, shortly abbreviated as CAMT. It involves the constraining use of the unaffected side, usually only one upper extremity, to force the use of the affected side. The individual then participates in the intensive training of the affected side to promote neuroplasticity. Usually patients tend to ignore the affected side, but here in this case of constraint-induced movement therapy, it involves constraining the use of the unaffected side and to force the use of the affected side. This is highly repetitive and intensive training provides a spinal cord with the stimulation which is necessary to make the neuroadaptive changes and improve the affected functions. Home exercises. Home exercises, the key to recovering the functions which is affected by spinal cord injury is to repeatedly practice them. Individuals can boost their recovery by assuring it that they practice the targeted exercises at home repeatedly and frequently as recommended by the therapist. FitMe is a popular full-body home therapy tool that can help you to improve hand, arm, and leg mobility after stroke or after TBI, traumatic brain injury, spinal cord injury, or even after cerebral palsy. FitMe is a home therapy program that makes repetitive exercises as in the form of the fun. It turns the everyday exercise session into a game and thereby challenges to perform a certain amount of repetitions before time runs out. So by making rehabilitation more engaging and motivating, individuals are more likely to see functional improvements in case of Brown-Sequard syndrome. That's it with a brief introduction and brief content of the Brown-Sequard syndrome. Thanks for watching. Kindly support by subscribing and sharing. Thank you once again.